Okay, good afternoon, all. Good afternoon, and welcome to all in today's webinar. I thank everyone for being here today. Today, we are going to discuss, we are having a session regarding bedside manners, which is not being just professional or just putting a smiling face in front of your patients, but in actual, it substantially affects our patient's health and is very critical to become an effective physiotherapist. And the irony is that it actually takes a back seat in our medical education. And so we need to develop these etiquettes and manners. And so, for the same, today we are going to discuss two of the major aspects concerning this, that is, doctor patient communication and the habits to practice during consultation. For discussing such a different aspect of our field, we have here today Dr. Neha Mishra, ma'am, who is Masters in Musculoskeletal and Sports Rehab from Glasgow Caledonian University, United Kingdom. Currently, she is a clinical therapist running her own private clinic named Just Heal at Goregaon. She is a certified nutritionist and is also a cupping, taping, and a dry needling therapist. All above, she has completed her international certification with distinction in intra-articular injection therapy. She has also worked at Nanavati Hospital for a short period. Shining in her crown are four published researches and two are still on their way. We are privileged to have you here, ma'am. On behalf of the whole BITS fraternity, I welcome Dr. Neha, ma'am, today. I would like to inform our participants that we are running a live session of the whole webinar, and thus, if you miss anything, don't worry, you will be able to catch it up later on our YouTube channel. Further, to maintain a smooth continuity of the session, I request all the participants to mute off their microphones until required and show your cameras until you are asked to on it. We will have the question answer session at the end, and that is when you can all text your questions in the text box. So, without much delay, let's start today's webinar. And for that, I request Neha ma'am to preside over the session. Over to you, ma'am.
Good afternoon, everybody. My name is Dr. Neha Mishra. So, while Purvi ma'am was introducing me, did somebody notice anything? I want this to be an interactive session. So, whenever you want to speak, you can just unmute and speak. What did you notice 2 seconds back while she was introducing me? Anybody?
So I actually saw that you were fidgeting with your mobile or maybe
That's
something.
correct. That's correct. And you might be thinking, how unprofessional. She's the resource person today. She's going to take webinar. And while the ma'am was introducing her and she was using her phone, what sort of thinking is this, or what sort of behavior is this? Similarly, every profession and every professional meeting, there is an expectation of certain behavior from both a client or a resource person or a patient, as well as from a doctor or any professional for that matter. This is what we will be discussing today. So, we will be looking out for bedside manners, etiquettes, and some gestures that we should follow while consulting patients. So, before that, I would want everybody to turn on their cameras. And whenever asked, you can unmute and talk because it is good to have a healthy discussion rather than just one-way interaction. Y'all would be a good listeners, but I would like people to talk as well. So without any further delay, I would start and I would share my screen and just let me know if you are able to view my screen. So is my screen visible to everybody?
Yes, ma'am.
Okay.
Yes,
Thank
ma'am.
Okay. So we'll be looking at bedside manners. So what is bedside manners? Do you have any idea? Anybody? What are your opinions about bedside manners? I'm waiting for answer. I'm not going to move ahead until I get an answer. Let it be interactive session, guys. दोपहर है, खाना खा लिया, it's fine, but get some zeal. If you are typing on the chat, I am unable to see it. It's better if you unmute yourself and express your views about bedside manners. Anybody?
Maintain some manner and discipline while attending any patient.
Okay, correct. That's not wrong. It's a one way a definition for bedside manners. Anybody else? Any ideas?
We will have to be very polite and kind with the patients.
Correct. Good. So that's both of y'all are very correct. So what is bedside manners? Bedside manners refers to a way doctor interacts and communicates with patient. A doctor with bedside manners is a good communicator, while one without a bedside manners may offend or may be overly abrupted with patients. Visiting a doctor can be very stressful situation for anybody, for any patient, or even for that matter, for a doctor who's become a patient, who's playing a role of a patient. Visiting other doctor is really very stressful, and having provider who is friendly and attentive can make a lot of difference in patient experience. Empathy plays a very important role in providing the best care to a patient. So, what is the importance of bedside manners? So, importance of bedside manners is that it creates awareness. A good bedside manner will help you create awareness amongst the patient and the therapist about the true situation as the patient builds their confidence for the therapist. Second is professional code of conduct. Bedside manners helps a therapist to grow personally and professionally. And once you develop these habits, you grow in your career. It also helps you to improve communication. When a healthcare worker has an open, honest communication, patient always opens up and shares their concern with full trust. Bedside manners also helps in improving interpersonal relationship among staffs. A clear communication of patient's history, treatment should always be given during a handover or takeover during a rotational postings. Sometimes there are important things or important history of a patient that a therapist should be aware of or should be informed prior to handover of or takeover of a patient. For example, it could be if the patient is pregnant or if a patient has a heart condition or anything. So these are really important aspects that plays a vital role when you have a good bedside manners. So there are three key factors of bedside manners. One is communication, the other is gesture, and one is an organizational setup. So, communication and gestures go hand in hand. So, my question to you is what is communication? What, according to you, is communication? You can unmute and tell me what are your views for the word communication.
Communication means when you say something, the other person understands.
Okay.
And
Anybody else? Yes.
you communicate in such a manner that
Mm-hmm.
it is, respectful to the other person also.
Correct.
And you explain yourself in such a way that the other person understand in what context you are talking.
Yes, absolutely correct. So, communication is exchange of information that could be in three ways. Either it could be verbal, it could be non-verbal, or it could be written. So, let's see what is, these different types of communication in detail. What is a verbal communication? It is a type of communication where healthcare workers talks or discuss with patient. This is an important aspect to build doctor patient relationship. Verbal communication can be face to face, it could be over a telephone, or it could be in a written format via text or email. A verbal communication should comprise of three things: clarity, confidence, and your tonality. So, clarity, you should be very clear in your communication and concepts during your consultation or treatment. Explain your condition in a layman's term and your approach to treatment so that the patient has clarity about everything and leaves the place with no doubts. You should be confident. The therapist or a healthcare provider should always be confident in what you speak. Confidence always shows your intellect. When you are confident, it gives confidence to the patient, and the patient will in turn give their trust to you because they are coming with pain. They're coming with hope to you. So, confidence plays a very vital role in communicating. The third thing is tonality. You should maintain a soft pitch tone and never lose your calm, even if you have to explain a same concept again and again to patient. There, there are people who take time to understand. So you should never lose your calm. You should always explain, if not once, twice, if not twice, then thrice. What is non-verbal communication? So non-verbal communication is all type of communication that do not involve exchange of words. However, it involves your facial expressions, your clothing, your way of walking, your body postures. When we communicate, our 10% of our communication are words. However, 90% is non-verbal communication. As soon as the patient walks it, and it's a two-way road, let me tell you guys. As soon as the patient walks in, we get an idea about how or what the patient must be suffering from. If a patient is walking like this, you have an idea the patient has pain or the patient has some problem with the shoulder. If the patient is walking by limping, so there is some problem, you analyze the gait. Similarly, vice versa, when a patient enters, the they look at the doctor, whether the therapist or the doctor is looking at them, whether they are greeting them, whether they have a smile over them. So these are body languages that speak a lot. These are unsaid communications. So what is important? Why is body language so important? Body language plays a role in intuition as it gives us message about other person that we can interpret at an intuitive level. Basically, एक wavelength होता है where we understand कि yes, correct, he is coming to me and he's limping. Maybe he must have had a fall, or maybe he must have had there might be an underlying condition. You start talking, you start having an intuitive brains set talking. So non-verbal communication comprises of facial expressions. It is primary site of expressing emotions. It really reveals type and intensity of your feelings. Eye contact. Eye contact always helps you establish a rapport with other person. Gestures and posture. Gesture can explain both specific and general messages. They can be substitute of words or can elaborate on them. Handshakes. Communicate your mental state and level of confidence. So these are some non-verbal communication which are very peculiar. So when you have a facial expression of smile, that means you are happy and you are happily greeting the patient. It is two-way communication. Again, I'm telling you guys. Eye contact. When you have an eye contact with a patient, you know that yes, I am here to help you. I am here. It gives a confidence or it gives a message to a patient that yes, this doctor will help me, this therapist will help me, this therapist will help me ease my pain. These gestures of handshaking, of saying hi, of waving, these are the gestures which gives an idea to a patient that you are welcoming them, you are going to be attentive to them, you are going to listen to them, you are a person who is ready to solve their problems. So these gestures plays a very very important role while consulting a patient. My next question to you is, every student or professional must have gone through something known as patient or personal history. Why is it so relevant? Can anybody tell me? Why is it relevant for us to know a patient's history? Anybody?
To get an idea about the patient's condition as well as what he or she is suffering from.
Correct.
To
You know,
get an idea about the course of the illness, uh, what is the onset and regarding the course of how it
correct.
started and how did it continue.
Yes, very true. So something known as demographic data. If
And
everybody
also
is,
the this thing, what type of medication she's been taking, whether it
yes,
has helped her or not helped her, help him
correct.
or her.
Very good. So when we talk about personal history, the first thing we ask is the name. Why do we want to know the name of a patient? Because it helps you to be familiar with the patient and also possible etiological diagnosis. So certain conditions are very important and can be guessed by the name of the person. So if I have to give you an example, a patient walks in and I ask him, good afternoon, sir, what's your name? So the patient replies, hello, ma'am, my name is Rustam Irani. So when I listen to this name, Rustam Irani, and the first thing that will strike my mind is G6PD. A G6PD is a deficiency of enzyme that leads to various types of adverse reaction to certain drugs. Drugs such as painkillers, sulfa drugs, NSAIDs. If taken, it can lead to severe bleeding, and sometimes it could be very critical for patients. So, just by a name, you know that the patient belongs to a certain community, a community where this condition is very common. So I cannot prescribe this patient a painkiller or an anti-inflammatory. This would have an adverse effect. So this is what you come to know. Other importance of knowing the name is that when you address a patient with their name, The patient feels there is a sense of satisfaction. Oh, yes, the doctor remembers me. Oh, yes, the doctor knows me very well. So, names play a very important or a very vital part of your consultation. Then again, the second thing is age. Some diseases are very common in certain age groups. For example, uh, osteoarthritis is very common in people above age 40. Sometimes it is seen in early cases. However, uh, it is seen beyond 40. Those are common age groups. So when a patient of 40 years and above comes and says that, my knee hurts, I have pain, I cannot ascend stairs, descending is difficult, it hurts. So there are differential diagnosis that comes in your head immediately knowing the age of the patient. There are certain diseases or there are certain conditions which are common related to type of sex. Some conditions such as rheumatoid arthritis is more frequent or more commonly seen in females as compared to males. So gender also gives you an idea what can be or what could be the condition. Race, some diseases or some conditions are common among certain races. Occupation, some conditions are very peculiar in occupation. So if a patient comes to me saying that, if I ask, sir, what do you work? So he says, I'm a laborer at a company. So that gives me an idea that the patient has come with a back pain, with a complaint of a back pain, and he is working as a laborer. He might be lifting up some heavy objects. It could be a mechanical low back pain, or it could be due to faulty postures. That will help you to decide your assessment and also your treatment protocol. Some conditions are common in place of residency, like a condition named gout. It is commonly seen in places like Himachal Pradesh. So when you know from where or which area the patient is coming from, you know this could be condition. If you want to relate it now, uh, during this COVID crisis, we ask patient, where are you from? So they say, I am from Mumbai. So Mumbai being a hotspot of COVID, that there might be a chance he might be infected. Similarly, marital status and offspring history would help us correlating certain conditions dealing with hormones or dealing with fertility or other conditions. Habit of medical importance, for example, addiction, smoking, bird breeding. These are conditions when if a patient is smoking, that would delay the time of healing, that would add on to the inflammation. So these are certain small very small things but gives you a lot of information. So these personal history plays a vital role. It should be a strong foundation for your differential diagnosis, for your approach towards patient, and also to understand the mental health, the mental condition or the mental stability that patient has come to you with. Moving on, organizational setup. So a proper space planning can positively alter the morale of a level of your setup as well as the patient when they first enter. When you take time to ensure functionality in your workspace planning, you are also setting your business up for efficiency. Try creating a space that is not only functional but allows for inspiration and helps de stress when needed. So, first impression is always the last impression. It goes for a person as well as for the place. Whenever we go to a restaurant, we see, wow, what an ambience. Wow, we would want to click photograph. Similarly, if you visit a physiotherapy setup, a hospital, or any workspace for that matter, the first thing you see is the ambience, is the interiors, is the setup that is there, that will give you, wow, there are so many, modalities, there are so many equipments. They are really very peculiar. Everything is clean, they are hygienic, they are following all the hygienic norms. I am happy, I am satisfied. The satisfaction of your eyes, the satisfaction that gives you, it will boost your morale. A clean environment spreads positivity. That also helps in, speeding up the healing process. So let's see appropriate bedside manners. As I said, first impression with patient really matters a lot. A healthcare professional has only one chance to make a positive impression when meeting a new patient. A few courteous action can help promote a positive initial interaction. Always greet. Greeting could be a handshake, a hello, or a namaste. Of course, during this COVID, I would say use namaste or hello. That's the best way to greet patient. But always greet your patients. When meeting a patient for the first time, you should know their name and make sure you pronounce it correctly. If you're unsure about the pronunciation, ask the patient. Sometimes there are complicated names and you are unsure about the pronunciation. So when uh, you know, pronounce the name incorrectly, the patient might get offended. So if you're unsure, always ask, sorry, I did not get your name, sir. Can you please pronounce it for me? Never call an adult by their first name unless you have been asked to do by the patient. Always address by using a prefix of sir, ma'am, Mr., Mrs., hello. So these are the prefixes which shows that you are very respectful towards the patient, and the patient feels really very happy and obliged by the therapist himself. Second, strong communication is a key. As I previously mentioned, communication, a physio's ability to communicate with a patient can make or break their bedside manners. It helps them to build a good rapport with patient, and more importantly, it creates trust. If you communicate clearly and honestly, you would be able to obtain certain information even the patient's relative are unaware of. There is something known as doctor patient confidentiality. So when you give an assurance to the patient that our talk is confidential, that will help patient build in trust and tell you everything clearly. What happens is, sometimes it happens, and many must have experienced it, that you ask a patient, do you smoke? So a relative must be sitting beside him and they will say, no, I don't. But he might have been smoking for years, and if that is the case, that would delay the healing process, and you will not know what could be the condition. And maybe smoking might be a primary cause of the condition that has taken place. So it's better to ask the patient in private when you are taking history. You could always say the relative, could you please wait outside till I evaluate my patient? Ask the patient in a confidential manner so that a trust, a rapport is created between the doctor and the patient. The ability to communicate is probably the most important skill a physiotherapist can possess. Good bedside manner can make or break a patient's interaction, either encouraging an honest discussion or putting off the patient. As I mentioned earlier, good bedside manners set the stage for a successful interaction between patient and a doctor. Speak professionally and accurately, but in a way the patient can understand. When you are steeped in a medical jargon every day, It is easy for you to use the technical terms. When speaking with patient, what happens is, if a patient enters and you say, ki, do flexion. Okay, you know what flexion is. What is the action of flexion? The patient is unaware. The patient is not of your medical field. However, you can say, do flexion, and you can show the action of flexion. Or else you can say, sir, can you please take your hand straight up? Do the action so that with your visual as well as auditory, it is easier for the patient to understand what a therapist is asking him or her to do. A very few of your patient will have medical background. You need to convey information in a manner that the patient can comprehend. Always try to have an open communication and honest communication, but do not tell your patient medical terms that will hype the situation or create unnecessary panic amongst the patient and the relatives. So be an active listener and present in interaction. Like all of my audience today who are actively listening to me, and I am speaking. So if you're taking notes on medical history or symptom a patient is encountering, it can be easy to get lost in writing or typing. A physio must remember to display active listening and face the patient as they take notes. So what happens is, for example, I am a therapist and my patient is talking. I would write the notes. Oh yes, this is the history of presenting illness. You have to, of course, make notes, but then while writing, even one look at the patient, an eye to eye contact, and a gesture by nodding your head will give a message to a patient that yes, even though the doctor is writing, but they are listening to me, they are attentive, they are understanding what had happened, what I am trying to say, what I want them to understand. So you should not always just go on scribbling notes. Always address the patient, always be an active listener. There might be information, there might be small tiny incident that could change the whole scenario of your diagnosis. So you should always actively listen. When you are in rush, it is all too easy to cut off a patient with question, but hold back on interruption in the beginning of the interaction. Allow the patient to share what they're experiencing before you dive into more detail. So as soon as I say, ki, sir, could you tell me, or ma'am, could you tell me what had actually happened? How did you hurt your shoulder? Or how did you hurt your knee? So let them speak. Even though if you have a question, for example, if a patient with a respiratory condition says, ki, I had breathlessness and I was coughing, do not dive in the question directly. Was the cough productive? What color? How many times? No, do not do. These are not good manners. Always let the patient speak, and after they finish, politely ask them, sir, you mentioned that you were coughing. Ma'am, you said you were coughing in the day. But could you tell me what was the color? Ask politely once the patient finish their interaction. If you interrupt, there might be some data that the patient might forget. It happens with everybody. So for example, if we are talking and I was speaking something and somebody just interrupts and then say, and the third person will say, what were you speaking, Neha? And then I will say, oh shit, I forgot, they interrupted. This is what happens with the patient as well. If they are telling you a history and you interrupt them, there might be information that can get withhold with them and they might forget to mention. So always be an active listener, let the patient finish, and then you can get into more details. Do not overlook the power of your body language. This is the utmost important aspect of bedside manners. Body language is a two-way street. Good bedside manners requires a physio to display open and professional body language. A physio will also need to decipher a patient's body language to pick up on things left unsaid. Also, be aware of your own body language. Look directly at the patient when you are trying to make an important point and control any habits that may cause a patient to doubt your credibility, honesty, and self confidence. So, what happens? Body language is not only of patient that you have to observe. Patient also observes a therapist's body language. When going in the wards, when going in rounds, what happens is, sir, what happened? What was the case? There is no confidence. Or if you're fidgeting, you have a pen in your hand and you're just doing like this. हाँ, क्या हुआ था? कैसे हुआ था? अच्छा अच्छा ऐसा हुआ था. So this is distracting to the patient, as well as it gives message that you are in hurry or you are not interested. Or अच्छा, if you're folding your hands like this and standing, अच्छा बोलो क्या हुआ था? ओके ओके, तो तुमने ऐसा किया क्या? तुमने हॉट पैक लिया था कल? So this attitude or this gesture is not welcoming. The patient will have a question in their mind. What type of therapist was there? So much of arrogance, so much of attitude. Not good. However, if I keep my hand like this down and ask, what had happened? Did you do your exercises properly? Did you take your medication on time? This interaction or this type of body language is acceptable. This will help the patient to understand that yes, you are giving the patient the undivided attention that he or she deserves. Sometimes it happens that, okay, you do your exercise, you do your repetition, and then you are busy in your phone or you're busy writing. You will not even understand if the patient is performing the exercise correctly or not. If you're busy with doing something, putting your hands in the pocket, and then the patient is just exercising and you're looking here and there, what sort of feeling a patient would get? The patient will say, there is something known as mouth publicity. The patient will go out and say, वो थेरेपिस्ट अच्छा नहीं है, उसका कोई ध्यान ही नहीं था मेरे ऊपर, हमेशा अपने में ही बिजी रहता है. These are the words, these are the sentences the patient actually use while going out and talking. However, when you are paying attention to the repetition, what muscles or what muscle is getting activated, if the patient is doing the treatment, the exercises correctly or not. If the patient is not doing the exercise correctly, they will not get the desired results. And who is to be blamed? The patient will blame the therapist, that you told me to do it, but nothing is happening. But what happened in the back? Let's go to recap. The therapist did not pay attention. That was, there your credibility gets lowered. And these are certain body languages or gestures that you should avoid. Talking about value your patient's time as much as your own. Physios can be busy, but patients are as well. When you are running late or can't honor their time, acknowledge that. Your patient will appreciate it. So, when when I was studying in UK, even a 2 minutes delay in my clinic, the patient would write a big feedback that the therapist was not punctual. There, there is a rule that, therapist has to be present before the patient arrives. The therapist has to be ready before the patient is already there. In India, um, there are a lot of professions, there are a lot of doctors who, make their patient wait for 1 hour, 2 hour. They give you appointment of 11 and they turn out at 12. Even patients have a life, even they are profession, even they are working somewhere or for someone or for something. Even their time matters. So if you are running late, or if you're tied up somewhere, or if you're caught up in a traffic, always text your patient and say, I'm really sorry, or I will be, there in 15 minutes, or can we postpone it? It would be help, it would help the patient to manage their schedule, to reschedule their plans. Never, you know, uh, never say that, your time is not important and mine is. Everybody's time is important, and time is really precious. So failing to recognize when someone has been waiting is disrespectful to patients. Multitasking is not essential. So, sometimes it happens that two patients turn up at a same point, and you are assigned two patients, and you will be like, my patient A and my patient B are here at the same time. What should I do? So someone will say, do it together. What happens? This is not correct. Multitasking is good, but not in our profession. This will, you know, hamper, or this will have a problem in the patient's confidentiality. The patient will, everybody is not open to group talks or group activities. Some people like their lives to be private. So if you're attending two patients together, one might be okay with it and one might not be. So this is unethical, and this is not a professional code of conduct. However, what you can do in this situation is tell your patient A that my patient B is already here. Let me tell them to wait in the waiting room, and I will join them shortly. Attend one patient at a time. Do not start counseling or consulting same patients or with patients with similar condition together. They might not like it. Similarly, if you see a picture, a picture which has a cross, there are two people who are exercising alone, and the other two people have therapist. Why is it wrong? It is wrong because the patient, you are not paying complete attention to the patient. The patient feels left out. The patient will not trust. The patient might exercise wrong. However, ethically, it is incorrect. When you treat patient, give your undivided attention. See to it that you are not compromising their confidentiality, their trust, and their help. They are there to you, or they have come to you to ease out their pain, to get better. And what happens if you do not pay attention to them? So these are certain tips or certain mannerism that we should follow. So in today's fast moving world, technologies have increased. When you think about corporates, they have a layout, or they have been trained for certain communication skills or communicational set. So if they want to send out a message, they have a layout ready. They will just edit your name and they will send it to you. So when you get a customer call, you'll see the tone of their voice, the sentences that they use. It is same for everybody because they're trained. However, it doesn't work with a healthcare profession. The doctor has to face doctor has to meet a new patient every day, and doctor has to approach a new patient in differently. Every patient is not same. Some might be, for some patient you might have to go a little slow. Some patients you would have to go little, if they don't understand their language, you have to you should make them comfortable by talking to their native language. Try to talk in their native language so that it is a comfort zone for them. So you always, for doctors, every day is a challenge to see new patients, to talk to new people. So try to incorporate these small habits and you will see yourself growing as a beautiful professional. So my takeaway message from today's session is that manners cost nothing, but it means everything. So, with this, I let the floor open for questions, and I would be happy to answer any question you have or any discussion that you would want to do.
Thank you, ma'am. So now we are open to questions. Those who have questions, kindly enter your questions in the text box.
You can unmute and ask questions rather than typing it on the chat box. No question? Anybody wants to share their experience? Anybody who would like to add certain points? If I have missed out on any.
Ma'am, we shall wait for a minute so that we
Sure.
can find out if there are any questions.
Yeah.
Participants, please ask your questions if you have any. Yes, ma'am, we have a question from Matrix. He's asking whether how would you recommend communicating during a group therapy session?
So when you are in group therapy, what you do is first you make, how will you convince a patient to join for a group therapy? The first thing is you have to convince the patient, and convincing how? By telling them what would be the benefits. So that is an open face-to-face communication. Once the patient agrees for a group therapy, then and then only they'll get joined in the group therapies. So when you are in a group therapy session, you talk to them in an open communicative manner by saying them, yes, today we all are here and we are suffering with the same or with a similar condition. However, if you share your story, it will be helpful for someone to relate to it, or to understand the improvement or what they have been through. The other will understand. So for example, if I am a patient and I'm in a group therapy, somebody is telling me ki, I was unable to lift my hand, but after doing physiotherapy for around 5 months, now I'm able to have, and I am newly diagnosed with the same condition. So that story will help me motivate to exercise, to perform better, to be consistent with my exercising, and I might get better. It will give me hope. So in group therapy session, open communication matters a lot.
Okay, thank you, ma'am. Anybody? Anybody? Someone has any questions?
You're welcome, Matrix. Has anybody encountered any situation like this where the patient got violent? or the patient got angry when you were not paying attention. Nobody ever experienced such thing. Okay.
Participants kindly answer, reply, ma'am, or else ask any questions if you have any other area to discuss. Yes, ma'am. There is one question from Ayushi.
Yes.
What if your patients continuously complain about pain during therapy? What would be the reason? Is he not interested or something else?
Okay. So I don't know what exactly you are referring it to, but let's say you are treating a patient of frozen shoulder and they complain of pain while you doing manual therapy. So the when you know there are different types of pain, there might be there are various patients also. Notorious patient might just say, "Ki, yeah, it is paining." So you are therapist, you have knowledge about it. Try to not give a therapy like a placebo effect and see if the patient is still complaining of pain. So that will help you to understand if the patient is actually not interested or actually it is paining. So you have to analyze the tips and tricks. You have to apply your knowledge to understand what the patient is actually going through. There might be a phase where there is no pain. You know it. But the patient says, Ki, no, it is paining. I'll not do it today, but I'll do it tomorrow. That's when you know either there could be two options. Either the pain is psychological or the patient is not interested. So you have to be the judge that time and tackle the situations in an appropriate way.
Yeah, thank you, ma'am. That's true. Any other questions?
Welcome, Ayushi.
Okay, ma'am. There is a question from Krupa.
Mhm.
She says, as you said, communication is very important to create rapport with patients, but in this pandemic situation, it's difficult to go for proper communication with mask and PPE kit. So, how do we gain the confidence of the patient?
If you remembered, in the very beginning, I said what is bedside manners, and in that, I mentioned a point saying empathy. So, when you approach a patient with a PPE kit on and it is difficult for you to communicate, just one sentence you can very well say to patient that I understand what you are going through, uncle, sir, ma'am, but if you exercise, if you do these breathing exercises, it will be helpful. It will help you breathe easily. So just follow my instruction. As I am doing it, you do and see it will help you. Just one small empathy, one small gesture of care, one small gesture of honesty will help you gain a complete confidence from your patient. I hope I answer your question. Thank you, Kripa.
Yes, ma'am. True. Any other questions?
This could actually mean one thing or two things. Either everybody has understood everything or nothing at all. But anyways, I am really very happy for being here today And I am thankful to Bits College who gave me an opportunity to be here and share these things. And one message for everybody is have empathy towards your patient, be confident, and be clear, and grow professionally. That will help you to become a good professional. Thank you so very much. It was my honor to be here with you guys today.
Yeah, thank you, ma'am, for such a wonderful practical session. I'm sure uh, today all would have taken a new message today regarding etiquettes and manners required to deal with their patients. So next time when we deal with the patients, we shall keep these things in mind and implement the good bedside manners so that you can build a trusting and a more effective doctor-patient relationship. Uh, on behalf of BITS Institute of Physiotherapy, I thank our founder, president, and chairman, Honorable Shri Jagdish Bhai Patel sir, and our CMD, Honorable Shri Dhruv Bhai Patel sir, and Joint Managing Trustee, Srimati Kamalbeen Patel ma'am, for supporting us to organize the session. I extend my gratitude to our campus director, Ms. Hadi Patel ma'am. I thank Dr. Mehul Jadhav sir, Principal, BITS Institute of Physiotherapy, for giving us a free hand to arrange this session. I also thank Dr. Sarfraz Nawaz Shah sir, Vice Principal, BITS Institute of Physiotherapy, for helping, organizing, and presiding the whole session. My special thanks to Avni ma'am, HOD Computer Department, for her technical support in this webinar. I also thank Gade Dada, our graphic designer, for his great creative work for making the flyer. My sincere thanks to all the faculty members for lending their indirect and indirect support throughout this session. Last but not the least, I thank and appreciate such a great enthusiastic participation in today's webinar. Ma'am,
Yeah.
thank you so much for being here today and opening a new insights in a new area of our field. And once again, thank you all of you.
Thank you,
Have a good
Purvi,
day.
ma'am. Thank you. Have a good day. Stay safe. Stay blessed. Take care.
Thank you, ma'am, and same to you.
Thank you.